My dear colleagues, ladies and gentlemen, my audience, greetings from El Fayouz land. I am Dr. Ahmed Gaber Imara. I'm an assistant lecturer of cardiology at Cardiology Department, Faculty of Medicine, Menofia University, Egypt. Today we will start with our first episode of educational cardiology series of videos under the title of Preoperative Cardiac Assessment of Patients Undergoing Non-Cardiac Surgery. To understand the importance of this topic and the scope of the problem, there is worldwide more than 200,000 major non-cardiac surgical procedures done annually. Of them, 1 in every 20 patients suffers myocardial infarction or myocardial injury, cardiac arrest, and death within 30 days post-operatively. And perioperative cardiac complications accounts for 30%, about 1/3 of perioperative deaths, and this is a huge number. In Europe, annually 5.7 million procedures done in patients with increased risk of cardiovascular complications. For of them, about 167,000 cardiac complications due to non-cardiac surgical procedures occurs, and of them 19,000 are life-threatening and may lead to death. Unfortunately, here in Egypt we have no specific data about perioperative mortality, and by googling the literature I have found an article under the title of Perioperative Mortality, an emergent global public health problem, published in the Egyptian Journal of Cardiothoracic Anesthesia. But unfortunately, I found that they spoke about the data of European Union and not in Egypt. So we need specific statistical studies and data and registers to figure out the exact magnitude of the problem here in Egypt. The importance of this topic is due to there is a high incidence of perioperative cardiac mortality and morbidity. The presence of cardiovascular comorbidities has an important impact on post-operative outcome. We should know the impact of risk reduction strategies like using medications like beta blocker, ACE inhibitor or ARB, statin, platelet inhibitors, oral anticoagulants, and their impact on reducing the risk of cardiac mortality perioperatively, and also the need for coronary revascularization, either using the PCI, percutaneous coronary intervention, or by open cardiac surgery, what we call CABG. And also there is a change in the surgical techniques and emergence of the laparoscopic procedures more than the open ones, and the impact of type of anesthesia on the cardiovascular complications. We will cover this topic in 3 video series. The first of them, we will discuss a stepwise approach for pre-operative cardiac risk assessment. In a 7-step approach, we will know how to best assess and manage the patient perioperatively. The second video will discuss the impact of various cardiovascular comorbidities on perioperative risk, like patient with an obstructive cardiac problem like a mitral stenosis, or patient with significant pulmonary hypertension, patient with ischemic heart disease, a patient with heart failure, and we will address the impact of these various comorbidities on the perioperative risk. And in the last video we will discuss how to manage and reduce the cardiac risk in each entity of these comorbidities, and we will summarize this and make it easy to use for practitioners. And we will at the end of this series we will make it easy for anesthesia physicians to assess and deal with cardiac patient when cost effectively ask for cardiovascular investigational tools, when they can ask for a consultant cardiac physician to assess the patient, when to postpone the surgery, and how to deal with it in a malleable way. The source of our information for this episode and video series are the 2014 European Society of Cardiology, European Society of Anesthesia guidelines on non-cardiac surgery, and also the 2014 American College of Cardiology, American Heart Association guidelines on perioperative cardiovascular evaluation and management of patients undergoing non-cardiac surgery, and the most recent one published in 2016 Canadian Cardiac Society guidelines on patients undergoing non-cardiac surgery. So wait for the first one in 3 video series about pre-operative cardiac risk assessment in a stepwise approach. These videos will be published on our page on the Facebook under the title of Dr. Ahmed Imara Weekly Cardio Talk Shows, and our channel on YouTube. So if you find these videos are useful, help us by making like and share for our channels on Facebook and YouTube. And goodbye.